Hi, everyone, and welcome to Rural Roots, A Road Less Traveled, a podcast by North Country Healthcare.
We're your hosts. I'm Gavin Cook.
And I'm Rhonda Anderson, and we're so glad you're here. Gavin, we have Tiffany Haynes with us today. Welcome, Tiffany.
Hi guys, how are you?
Good. How are you? We're
Good.
so glad you could be here.
I'm well. I'm very excited to have my turn on the podcast.
Awesome. Well, as a listener, I'm sure you know, we like to ask, how you got onto this road less traveled. Tell us who you are, what you do for North Country Healthcare, and how you got here.
Sure. So my name's Tiffany Haynes. I'm the Chief Nursing Officer for North Country Healthcare. I've been a part of North Country Healthcare for almost 9 years now, which seems unbelievable. It's been a really great journey for me. I started out as the director of hospice at North Country Home Health and Hospice, and altogether I worked at Home Health and Hospice for almost 8 years. And really, I think, reignited a passion inside of me for patient-centered care. Throughout my nursing career, I've been a nurse for almost 20 years. I've worked in many different areas of healthcare, on the inpatient side, on the outpatient side, and in the home setting. And I think when I came to North Country Home Health and Hospice, I was really looking for something a little bit different, and I found it. It's very unique, and it really reminded me of what it's like to care for people in their homes and meet them where they're at, which is a theme that we often talk about. And it really reignited something in me, going into people's homes and in the North Country and seeing what challenges they faced. And I think being from the North Country, we're very proud people, and we love to have our independence, and helping people either gain that independence or close out a chapter of their life surrounded by their family, which oftentimes become part of their family, was so rewarding to me. And I'm so thankful that I had that chapter in my life at Home Health and Hospice. Over the past year, I've taken a new role within North Country Healthcare as the Chief Nursing Officer. We've done some reorganization system-wide, and we're really looking to go towards function-based leadership. We're on a wonderful journey to high reliability, which I can talk more about. But that's been, my career in a nutshell here at North Country Healthcare. I grew up in Stratford, New Hampshire, so I'm a North Country girl, very proud to come from Stratford High School, and received a wonderful education. And I think there's something to be said about growing up in a very small community. And having those tight-knit relationships, I think, they really mean something to me, as now I'm, overseeing the clinical operations in the 3 hospitals where a lot of friends and family receive care. I really want it to be the best. And I think that I feel a deep responsibility to the staff and the patients of the North Country. So for me, I'm very lucky to have the job that I have, because it oftentimes does not feel like work, which I think is, you've kind of made it in your career where going to work doesn't really feel like work. This feels like something that I was born to do. And I knew from a very young age that I wanted to be a nurse. I was very young and I knew I wanted to be a nurse. I always loved to help people. I was always a babysitter and loved to be around, helping out. And so I applied early decision to nursing school, and it was never a question for me of what I was going to do when I grew up. Now I live in Lisbon, New Hampshire, and I have 3 children who I am very proud of. I think being a mom is the most important job that I have. And, I think as we navigate healthcare these days, it's really important to make sure that we're all finding good work-life balances. And so that's something I'm very passionate about to help our nurses at North Country Healthcare achieve, because it's tough sometimes when you're trying to give 100% at work and you're trying to give 100% at home, and we all know that weighs heavy on people. So what does that look like today as we're trying to, really retain our nursing staff and make sure that they're achieving good work-life balances is something that's really on the forefront of my mind.
I'd like to dive into that a little bit because, Gavin, we talked to Brooke recently, and she talked about how in her position, she was able to kind of shift meetings around and make it work, and that North Country Healthcare just really does have that work-life balance focus. What does that look like for a nurse who has a shift? Like how do you make sure that your nurses are getting that work-life balance? Or is that still a work in progress?
I think it'll always be a work in progress.
Yeah.
Shift work, working 12-hour shifts can be it can be really tough. I think a lot of times people think, oh, you only work 3 12s a week, you have 4 days off, but a lot of that time you spend recovering from
Right.
either working a night shift or, unpacking that heavy emotional baggage that comes with being a healthcare worker these days, to be honest. And it's not a negative thing, but I think that we deal and our nurses deal and see with a lot of things that are tough, to mentally work through. So yes, they might be working 3 days a week, but they're long shifts. And achieving that work-life balance is very, very important. So I think that when I started my role at North Country Home Health and Hospice, I had, 3 very young children. And my boss, he said, your family has to come first. That's important to him, which was really relieving to hear, because it's not often that's talked about is, ensuring that, you have that permission in a sense to put your family first. I think we all know that they have to come first, but how do you do that? And I think it's something that we'll always be navigating for our nursing staff. One of the things that we're working on is creating a float pool throughout NCH so that we have an extra layer of added staff for last minute call outs. We know that, sometimes people have to call out for various reasons, but how do we have an extra layer to support the staff? We're also working on creating a system-wide scheduling application. We have identified an application so that we can see the schedules across the system. So that makes it easier for staff to trade shifts if they need to trade shifts because they have something coming up. But I think it'll always be something that I will ensure that my direct reports feel empowered to ensure that they have that good work-life balance and achieve it, because we don't want to lose people because they're burning out.
Right.
And Tiffany, I know firsthand from working with you on a couple different projects that one of your biggest strengths, which I think you just kind of alluded to on accident, maybe, is your leadership style, in my opinion. But can you talk a little bit about the strengths and opportunities for nursing across the system and what that kind of looks like today?
Yeah, I think, well, thanks, Gavin. I never really saw myself as being in a leadership position like this, to be honest. When I was a nurse, I worked on a med-surg unit for 7 years on and off. I thought maybe I would be the manager one day. I went to get my master's degree, and I never saw myself being at an executive level like this. So I very, very much still see myself as a nurse. I don't work with patients, right now, but I did at home health and hospice. I would still visit patients and do admissions into hospice and do visits. And it's something that I really still see myself as a nurse taking care of patients. And I don't want to see myself separately. I don't want to feel removed from the frontline staff. So it's very important to me that, we're creating a culture at NCH that supports the frontline nurses. And I really want them to make the decisions. I should not be making all of the decisions. So as a leader, I really want there to be two-way communication. I want the staff to feel supported and safe. I think that's very important. Here at NCH, we have wonderful nurses who deeply care about their community. And it's evident when you walk around and you see and hear, you listen to some of the patient stories. And I think that, right now we're really working on empowering our nurses and making sure that they feel heard. We have changed the structure in which we have directors and managers in the clinical world, and all of our managers will be working managers as nurses, so they'll be required to work a shift alongside their frontline staff, which I feel is very important. On our journey to high reliability, one of the principles is deference to expertise. And the nurses know usually if something goes wrong, why it went wrong.
Right.
They know where, if we could tweak one thing, this would give them, it would make their job so much easier. So we have to be asking them what their thoughts are. Where do they think that we should be going? It's very important to me. We've been very busy making a lot of changes, good changes, but I think that I want to make sure that the culture that we develop at NCH empowers the frontline staff to feel like they have a voice, because for me, I really want them to be making the decisions, and I'll help set the vision and make sure we're on track, but I don't want to do it alone.
Yeah. Well, and I've talked on the podcast that I've had the pleasure of working directly for you, Tiffany, and how empowering it was to directly report to you. And I think that just speaks to your leadership style, but it does speak to you want the people who work for you to feel empowered and to make those changes and come to you with the solutions. That's so much more enjoyable as part of your team rather than always being prescribed to. And I want to talk a little bit, as I'm thinking about your workflow and how you've approached things, is you tend to go very grassroots when you've started a program. And I want to talk about the palliative care program that you started at North Country Healthcare and how that kind of do you root that grassroots approach because you are a local girl, or is that something different? And how does it inform your leadership now?
That's a great question, and I very much enjoyed working closely with you, Ren, and I very much miss you. So I think that the palliative care program that we started at North Country Home Health and Hospice was near and dear to my heart because we saw a huge gap in care for patients that weren't home health or home care eligible, but weren't ready for hospice, and we lost touch with them. And oftentimes they didn't have a resource in the community that was helping support them on their healthcare journey. I know that you've interviewed Jess Locke at Home Health and Hospice, and she's kind of explained the programs, but palliative care can touch a lot of lives. Palliative care is for patients with a serious illness. We work in Coos and Grafton County. We have the highest percentage of patients with comorbidities, but also, heart disease, lung disease, Alzheimer's and dementia, cancer, and all of those diseases can be lengthy, and they're all serious illnesses. And so technically, palliative care can touch a lot of lives, and we have an immense need here in the North Country, I think, for that support. A lot of our patients don't understand how to navigate their healthcare journey. Which specialist do I call now? Is my primary care still involved? Who do I go to for pain medicine? I'm not sleeping at night. I don't know where to secure food. I have spiritual and behavioral health needs that aren't being met. And palliative care really is supportive care, and something that, if done right and done well, I think can change the healthcare experience for a lot of patients. And I'm very interested in what the experience is like for patients. I take it very personally. I want to make sure that patients are always having a great healthcare experience, regardless of their diagnosis. Because believe it or not, you can have a wonderful experience on hospice. It can be life-changing because you can feel that support. And so palliative care was a niche that we said, hey, we don't have support for patients in our area. And we started a grassroots program where there was no clear payer source for us to do a palliative care program in the home, but we didn't care about that. We started seeing patients that needed us and navigating, what the next steps looked like for them to say, you're not ready for hospice yet, but until then, let's talk about your symptoms. There are conversations that I think sometimes we're missing today in our healthcare world. It's very personable talking about advanced directives and disease process. A lot of patients don't understand how sick or advanced their disease truly is, right? Because they just think that they're going to keep going along, and some of them do, but they need to know, what happens the next time you go to the emergency department and we really can't do any interventions because your heart disease is so advanced. Your heart's not pumping like it used to be. How can we support you in that? And then I think a lot of the times you do a lot more listening than you do talking in palliative care, which I am working on myself. I love to talk, but I think that the art to palliative care is listening to patients, because they're going to tell you when they're ready, but oftentimes we don't provide them with that space and silence to listen to what's really important to them. So in a nutshell, the palliative care, we started a grassroots program where we just started visiting patients in their homes to have conversations with them. And we kept tabs on them to make sure that they didn't fall through the cracks until they were ready to come onto hospice. We've grown the palliative care program with Weeks Medical Center. I think we still have a lot of work to do to have a robust palliative care program. There are places within New Hampshire and centers nationwide that do it really, really well. We're still getting there, but I think we're proud of the outreach to the community that the palliative care program offered, and we weren't focused on reimbursement, and we weren't focused on things like that. It was really patient centered, which is what North Country Healthcare is truly all about.
All right, Tiffany, and you kind of alluded to it a little bit at the beginning, but with your change in the last year from the home care setting to a more system role, what are some changes you've seen, and how have you been able to balance those changes?
Yeah, the transition from my CEO role at Home Health and Hospice to Chief Nursing Officer at North Country Healthcare happened a little over a year ago. I think it was a different mindset for me from going from the outpatient home setting world into the hospital setting. I think in my career, I always wanted to get back to the hospital setting. I really love the hospital setting. So I was happy for that opportunity, but I had a totally different environment to wrap my head around. Quickly into the transition into my new role, started going to the 3 different hospital affiliates, which, for all of you that live in North Country, are not close to each other. And
Right.
I think setting a schedule and a routine so that my direct reports knew where I was going to be, and, meeting them was very important. And one thing that as a leader that's worked well for me and has served, I think, me and my direct reports well, is having those weekly touch-base meetings, and not moving away from, I don't think there's anything new, so we'll cancel this week. If you have anything new, come find me. We routinely meet, even if there's nothing to talk about, because typically, something always comes up. And to oversee 3 hospitals that were not close to each other, that I was not at every day, and be responsible for the clinical nursing operations, I didn't want to get it wrong. So I knew that I had to kind of go in and be as visible as I could be, but start making those relationships with the leaders and building that trust. I think trust is very important, in our community here at NCH and in the North Country. And in order for people to trust you, they have to know who you are and that you're making decisions in the best interest of them and the patients. Yeah. So the purview that I was, my purview had changed. And one of the biggest things that I had to work on were some of the system goals that were different than what I was used to working at Home Health and Hospice. And one of them was barcode scanning. So I quickly came in to say, okay, we need to reach a 99% for our bedside medication verification, which is scanning a patient's wristband and the medication each time we give a medication. And the year before we had reached 98%, but it was a little bit of a struggle. So I went in quickly and started talking to the directors to say, how do we get to 99%? And I really had to make sure that they were all clear on what the goal actually was and how we were going to get there. And at that point, we were getting the barcode scanning data every 30 days. And I said, I don't think we're going to meet this goal if I only get data every 30 days. So we worked with the IT team, and we developed a way in which to get the data daily to all the nursing leaders at NCH. It came in a report right to their email. So you could wake up, look at your phone and your email, and see who missed a barcode scan the day before. And that was the game changer for us in order to meet that goal. But I think that, I had to really quickly change my lens, became 3 hospitals, and still had oversight of the home health and hospice. But it was very different. And I think for me, I needed to develop those relationships within the hospitals that I had at Home Health and Hospice to be successful. And that'll be a continual journey for me, is to develop the relationships and be seen at the hospitals and meet the frontline nursing staff. And I think see what's working for them and what's not working for them, see how we can move the needle forward. And making sure I was very clear with my communication and expectations, because that was something that I found with the hospitals that had 3 different leaders for nursing, that all the leaders were not on the same page when it came to even what the system initiatives and goals were, the strategic plan. And to no fault of anybody's, I think that, information is disseminated in different ways. And I think that we're really looking to streamline those communication lines and reduce the decision makers. I think that a lot of times when you're working towards one goal and you have 3 different decision makers, it's really hard to get to that goal. And we've seen, with the barcode scanning success, we were able to reach 99% actually very quickly into the fiscal year. I think in November, so our fiscal year starts in September, and in November of last year, we were able to reach 99% and maintain that for the whole fiscal year. And that's a big deal, because the nationwide benchmark for barcode scanning is 95%. And we were able to actually hit 99.5%. For many months out of the fiscal year. So I think that I'm not the one that did that. I think the frontline staff are the one that helped us achieve that goal. But I think just making sure that the leaders had the data that they needed, that was delivered to them very easily, was one thing that I had to jump right on when I came into my role. I think having a system position, it's going to challenge you, and it's going to make you have to I think observe a lot and listen way more than you're talking. And that's important for all of us to know. And I think the visibility and communication is very, very important. Leading a group at Home Health and Hospice, I was used to not seeing the staff every day, because it's a very much remote workforce at Home Health and Hospice. Right. So I knew that I could develop those relationships in a remote nature, not seeing people every day. But I think really the people that are reporting to you, they want to be able to get in touch with you. They want to have that time carved out every week to meet with you, so that they have your attention, which is very, very important. And for any leaders out there that are moving into a system role, I would say the one thing is, have those touch points and do not cancel them. If you're off Monday and you meet with 5 direct reports on Monday, move it to a different day of the week. Don't cancel them, because your staff needs that time with you to feel that connection and to build that trust. And I think once you have that trust within your team, the sky's the limit, to be honest. I think that you can achieve a lot of great things. And that's where I'm getting excited, because we're definitely building a team at NCH within the clinical directors. So recently, in the spirit of going towards function-based leaders, we have hired into a system director of inpatient services role. Her name's Andrea Tupik. She's been on your podcast. Yep. We have a director of surgical services, which is Teresa Alonso. We have a director of the emergency departments now, which is Tammy Berthume. And we have a director of nursing practice, and her name's Kelsey Blood. And so with the function-based leadership, those system directors will have system responsibility. So if Andrea is the director of inpatient services, she now oversees all of the 3 inpatient units at North Country Healthcare. But at those affiliates, she has working managers who will be responsible to be on site day to day and really work alongside their staff to take care of the patients that are in our communities. We'll be setting the vision. We'll be looking at strategic planning. We're looking at policies and procedures to make sure that every staff member is clear on what policy and procedure they use for a certain thing. But we need to have one policy and procedure for each item, because functioning in 3 different silos is not going to help us achieve high reliability. And at the end of the day, my goal is that regardless of which hospital affiliate our patients present to, that they have a very similar experience, and they can say, yep, I know that they've really paid attention to what's going to create a great patient experience, and I got the attention that I needed, and the communication was clear for a patient, and that our patients want to come to us and feel safe coming to us. So creating those system directors was really important to us in order to reach to reduce the variance that we have. And we're really excited. So the system directors right now are working on hiring their working managers. And we just met for the first time as a team yesterday. And I can tell you that partnering with the performance excellence team is going to be a game changer for us in order to really move the needle on the patient care that we want to be able to provide here at NCH.
Yeah, it sounds like kind of your secret recipe is really communication, to build relationships, to build trust over and over again. And I think there's one other project that you worked on early on that I want to get an update on and see how it's going. And that's your patient handoff project or campaign, and really changing, where we're at to that standard of excellence, especially around communication and trust building. Can you talk a little bit about patient handoffs?
Yeah. When I took the role, we had been working the prior year on ensuring that when shift report occurs in the hospitals, that the handoff happens at the patient's bedside, not outside the door, not at the nurse's station. It's important for us that, if you're in healthcare, that the greatest risk for error in healthcare is when there's transitions of care and going from one nurse to another nurse at shift change. There's a lot of information that needs to be exchanged, but it's not just the nurses or the clinicians, the LNAs that need to be in part of those reports. So we really wanted to make sure that we measured how often we were doing bedside shift report at each of the hospitals. And I went and I observed, and the clinicians, I think, really embraced it, but it took a little while to get there. It can be uncomfortable, I think, to talk about a patient in front of them to somebody else. So it takes a little bit of practice. But we did a large campaign, and we said that bedside handoff saved. I saved a life at shift change today by doing bedside shift report. Involving your patients and their families in that critical time, so that everybody is aware of, this is the plan for today, this is the plan for tomorrow, this is when we think you're going to be able to be discharged. The reason why we're not discharging you is because of this and this and this. And is there anything else that the patient or the family wants to contribute to that shift report? It's going to make the patient and the family feel so much more involved in their care. So that was really important for us to ensure that was happening at all of our sites. We continue to monitor it. We continue to tweak it. But we are light years ahead of, where we were several years ago, which is really good to see.
That's great. And I think I'm going to ask my famous question here, only because I think I already know what your answer is going to be, but I think it's the perfect time to ask it. What keeps you, Tiffany, grounded and coming back every day, ready to work, excited for the day, excited for the next thing? What keeps you ready to go?
I don't know if it's one thing, but I think that when you grow up in a small community, I think you want the best for your community, and when you have children in that community, I think you want to make sure that you're creating a future for them that is sustainable. And I would love if all of my kids went into healthcare. I don't know if they will or not, but I think my heart swells when my 6-year-old says that she wants to be a nurse, or that's very, I love that. But I want to make sure that we're able to create something in the North Country that's sustainable. I think it's a wonderful place to raise a family. I think it's safe. And what keeps bringing me back and wanting better and pushing is to create something that is very unique. We're creating something that's very unique at North Country Healthcare, which I love to be a part of. But I want my children to be able to live in an environment, if they so choose, that has a robust healthcare system where people feel like they don't have to travel, south of the notch to get excellent healthcare, because they truly don't. We can provide a lot of things here at our 3 hospitals. And I feel an immense responsibility to the patients of the North Country to ensure that they have excellent experiences at our hospitals, and that the staff feel supported. I think when you have engaged staff that feel supported by leadership, they're going to go the extra mile because we do for them. And I recently was told to check out a book called Patients Come Second. And at first that kind of catches you off guard. Shouldn't patients always come first? But the genesis of the book is that if you take care of your staff, and your staff are engaged, and they feel heard, and they feel supported, right, they're going to take great care of your patients. Right. So that's really my theme, I think, for 2026 is how do we, go above and beyond for the staff? How do we create a culture that's empowering, and we reignite the passion that I think, the pandemic really, I think, took a toll on a lot of healthcare workers. And how do we reignite the passion amongst all of us to say, like, we're doing something great. We should be proud of ourselves. We should celebrate. I was on a meeting earlier today where we talked about how are we going to celebrate better, because we don't do a great job at celebrating our wins. I love to be part of something unique. I think it brings me back every single day. And I think what we're doing here at North Country Healthcare is extremely unique. And I want my family to have access to the best of the best, and the community to have access to the best of the best in healthcare. And I really want to be part of building that and sustaining what we have here. It means a lot to me.
Great. Well, I know that you are familiar with the show Hot Ones, as you are on North Country Healthcare Hot Ones. So I thought, for this particular wrap up, we'd give you those 60 seconds at the end of Hot Ones to pitch whatever you have. So, what's going on in Tiffany Haynes' life that she wants to talk about it? Is it, what does the future of nursing look like? Why should we work at North Country Healthcare, or something else? Do you want
That's
to
great.
wrap
I
it?
did do the Hot Ones challenge, which
Yeah.
was eye-opening. And believe it or not, number 10 is not the hottest. Number 8 is the hottest. And they make you talk throughout the challenge so that you get air in your mouth, and that makes it hotter. So I was
Yeah.
trying to say as few words as possible so that my lips didn't fall off. I think North Country Healthcare is an excellent place to work. We're small enough that I think interactions feel very genuine and are very genuine. You don't feel like a number. And I think we really always have the patients and the employees' best interest at heart. We often describe ourselves as a family. I think we are very much a family. We strive to be a family. And I don't think that you find that everywhere, to be honest. I think healthcare has changed a lot. There's a lot of operational and financial pressures on healthcare systems. We are doing well, fortunately. And I think we've really placed a large focus on our employees this year. And I think that patients can see the change. And I was in the oncology and infusion department at Weeks, yesterday. We were giving out an award to one of our wonderful longtime nurses there. And I had tears in my eyes because the patients that were in the unit were also just very thankful and appreciative of what we were doing there and the great care that they're receiving. So I would say for anybody in healthcare that's looking for a change, that wants to be part of a family, reach out to Gavin. He's a great recruiter. We can find you a position, and we want you to be a part of our family. And I see myself finishing my career at NCH, and I am very proud to be a part of the team.
Great. Well, Tiffany, thank you so much for being here with us today. We really appreciate your time. We know how busy you are, but you make the staff a priority every day. And from the bottom of my heart, and I think I can speak for Gavin, thank you so much for everything you do for North Country Healthcare.
You're welcome. Thank you guys for having me on your podcast. It was an absolute pleasure.
Thanks, Tiff.
Well, Gavin, talking to Tiffany never disappoints.
Absolutely. I always tell people I'm so lucky to work on as many projects as I do with her. I think since probably my first day with NCH, she's been a big part of it, and I'm really lucky to have a leader like her every step of the way. She's great.
Yeah. And I think I've gushed about her before, but she's the reason that I'm at NCH, really, and the reason I've stayed. One of the reasons. Everything is the reason I've stayed, but Tiffany continues to be one of those reasons. So
Absolutely.
just so glad that we had a chance to talk to her. And I think that our listeners could hear how passionate she is about patient care and caring about her staff.
Definitely. And I hear it all the time from not only her direct reports, but other people around the system too. She does such a great job rounding and really making sure everyone is seen and heard. And it's so important, especially today. And with how big of a system we are, that she gets around to all of her clinical departments. I think it speaks volumes to her as a leader.
Yeah. Yeah, and I'm excited for some of the changes that have been happening across NCH, giving her a little bit more support, but that also means that, that frontline staff some support too. So,
Absolutely.
love to see it. So, next up, without further ado, we
Long awaited.
finally, the long awaited interview with Gavin Cook is coming next. So,
Yeah.
putting Gavin in the hot seat as we promised. We wanted to make sure that we got Olivia and Tiffany in here when we had those opportunities, but now we're gonna talk to Gavin.
I've been sweating it out, but excited.
Perfect. And then I think, Gavin, it's probably fair to tell the listeners what to expect in the next couple of weeks. So we're going to take a much needed break so we can enjoy our work-life balance for Thanksgiving. And then we will be back on December 3rd. And we'll remind everyone next episode too. And then we'll have 3 episodes until we finish season 1
Season
of
1.
Rural Roots, A Road Less Traveled.
I know. It has been so much fun. I've had a blast, and I don't have anyone to thank but you, because you're the one who started this
No,
all
thank you.
and asked me to join. So it's been a blast. I can't say enough good things. I'm having a blast.
Having a blast. All right. Well, until then, I'm Ren.
And I'm Gavin, and this is Rural Roots, A Road Less Traveled.